ACL reconstruction is surgery to replace a torn anterior cruciate ligament, ACL, a major ligament in your knee. ACL injuries most commonly occur during sports that involve sudden stops and changes in direction such as soccer, football, basketball, and volleyball. Ligaments are strong bands of tissue that attach one bone to another bone. During ACL reconstruction, the torn ligament is removed and replaced with a band of tissue that usually connects muscle to bone, tendon. The graft tendon is taken from another part of your knee or from a deceased donor. ACL reconstruction is an outpatient surgery that's performed by a doctor who specializes in surgical procedures of the bones and joints, orthopedic surgeon. The ACL, one of two ligaments that crosses the middle of the knee, connects your thigh bone to your shin bone and helps stabilize your knee joint. Most ACL injuries happen during sports and fitness activities that can put stress on the knee, suddenly slowing down and changing. You have a torn meniscus that requires repair. The injury is causing your knee to buckle during everyday activities. ACL reconstruction is a surgical procedure. And, as with any surgery, bleeding and infection at the surgical site are potential risks. Other risks associated with ACL reconstruction include knee pain or stiffness, poor healing of the graft failure after returning to sport. Before your surgery, you'll likely undergo several weeks of physical therapy. The goal before surgery is to reduce pain and swelling, restore your knee's full range of motion, and strengthen muscles. People who go into surgery with a stiff, swollen knee may not regain full range of motion after surgery. ACL reconstruction is an outpatient procedure, so you'll be able to go home the same day. Arrange for someone to drive you home. Tell your surgeon about any medications or dietary supplements you take. If you regularly take blood-thinning medications, your doctor may ask you to stop taking these types of drugs for at least a week before surgery to reduce your risk of bleeding. Follow your doctor's instructions about when to stop eating, drinking, and taking any other medication the night before your surgery. General anesthesia is typically used during ACL reconstruction, so you'll be unconscious during the procedure. ACL reconstruction is usually done through small incisions, one to hold a thin, tube-like video camera and others to allow surgical instruments access to the joint space. Your surgeon will remove your damaged ligament and replace it with a segment of tendon. This replacement tissue is called a graft, and it comes from another part of your knee or a tendon from a deceased donor. Your surgeon will drill sockets or tunnels into your thigh bone and shin bone to accurately position the graft, which is then secured to your bones with screws or other devices. The graft will serve as scaffolding on which new ligament tissue can grow. Your surgeon may ask you to wear a knee brace or splint to help protect the graft. Your doctor will give you specific instructions on how to control swelling and pain after surgery. In general, it's important to keep your leg elevated, apply a cold wrap or ice to your knee, and rest as much as possible. Follow your surgeon's advice on when to ice your knee, how long to use crutches, and when it's safe to bear weight on your knee. Successful ACL reconstruction paired with focused rehabilitation can usually restore stability and function to your knee. Within the first few weeks after surgery, you should strive to regain a range of motion equal to that of your opposite knee. Recovery generally takes about 9 months. It may take 8 to 12 months or more before athletes can return to their sports.
Thank you for watching this video. Hit the subscribe button so you can get new videos. You can read more about this on our website www.wellnessbuddy.com.